Hi, this is Dr. Scott Young, and we're going to do some NESARA-based questions. They're going to be a little broad here. I got 3 of them right now here. They're going to be insurance-based questions. Now, we're going to do some insurance and health-based kind of questions here. So we're going to kind of push on them. So sorry, I just got sick about a week ago, so I'm a little bit kind of plugged up here, but we're getting over it here. So let's just hit the first one. Will NESARA wipe out the need for insurance? Let me just hit that one first, and then we'll go through these questions with that. Well, no, you still kind of need insurance. I mean, if someone breaks their neck or breaks their leg off of the roof of your house, you kind of want to have liability insurance, don't you? If you wreck your car, don't you really want to have insurance for that? If you wreck someone else's car, don't you really want to have insurance? Yeah, you're going to need insurance. So stop, okay? So car, home, medical, yeah. But there are some types of things that are going to change. The pricing of that. And one of the things that we've seen in a lot of ways is that we've got to look at the overpricing of those particular products. So for instance, house and cars, we'll just use those as first examples. Houses and cars have been overpriced. So let's say a $300,000 house, I kind of believe those things are going to drop by, maybe a 30–40% drop in the next little while. And it could go farther than that, but it's not going to be like, don't think 1950s pricing. We've talked about that and talked about that. That is economically silly, okay? What we really want to get into is just an easy statement, okay, for related to insurance. If you have a $300,000 house, your house is $200,000, that's 33% off. Well, your insurance is related to that. So you would see a reduce in that. Good. Number 2, insurances have been really, really bad boys. And they have had billion-dollar quarters. We're talking billion-dollar profit quarters. So, and they're part of the sickos. And so you're going to see a spanking, okay? They have got to have a little spanking events that are going to come. And they might not be the EBS level spanking events, but they're going to have a spanking that's going to come, EBS into NESARA kind of thing. And they're going to take a hit. Their consumer confidence is going to go down to an all-time low, and that is going to affect them. And they're going to see people just drop insurances left and right, and they're going to get the most minimum insurances out there because they don't trust them. And so there's going to be a fight going on in there. And other insurance companies are going to jump up and go, hey man, we didn't do any of that same stuff. You're going to see lots of crazy things that are going to come out. And that's why I say, these people who believe we're running into the millennial reign and everything's going to be perfect and peaceful, I'm telling you, this is, first off, that's not even biblically correct, okay? Second off, this is going to have some chaos. There are going to be business, personal, professional chaos like you cannot believe. I was talking to another audiologist named Laura, and she and I were talking about this, and there's so much business chaos in just my field of audiology that I just can't even explain. So many woke audiologists that can't imagine when this thing comes down, it's going to freak them out. They're going to be like, right? Okay. But that's what also going to happen to the insurance industry too. So there are going to be lots and lots of changes. So you're going to see lots of drops in that. Now, second question, how does it affect Medicare and Medicare supplements or Medicaid, Medicare supplement plans? Well, Medicare is a government kind of related program, and then we have these supplements that are added on there. First off, Medicare has been ugly in the way that they handle things. And they're part of the government agencies. No, we need to keep them around. But we need to have a public spanking of them too. Those government agencies need a spanking. They have been underpaying those people on a dramatic level. See, we want to talk about the greedy doctors. Do you know that average, the healthcare providers get 9% of every healthcare dollar that you spend? 9% comes to the end provider. Who gets the rest of that money? The hospital systems that are in the middle of that, the insurances, and a whole bunch of other brokers in the middle of this stuff. This is the sickness. So we're going to start seeing a drop in prices on such a dramatic level with that. And I'm going to go even farther on that one. And there are so many ways that happen. You have to charge such a ridiculous price that you guys don't understand. You have to charge a ridiculous price just to get a number. And I've used this example before for you, but when I was going through my own miracle healing 3 years ago, it was a $142,000 ICU bed bill that they got. That they were and I mean, almost all. I was sitting right beside the you know how I have there's the trash can right here. So I have this drawer that pulls out with a trash can, and I kind of open the bills over because I'm throwing 90% of the trashy things that are not really bills, they're just junk. And I get this thing in the mail, and it's the first bill right after my event. And it's $142,000, and I'm on a puke over the trash can. And then I kind of read down over it, and United Healthcare, who really helped me out on this one, they knocked it down to $25,000. And then I read further, they paid $23,700, and then my amount was $1,300 or so. And I'm like, oh. You have to breathe a little bit. But just realize, and when I went through that bill even closer, they had to bill so much just to get that kind of amount. So we want to talk about the greediness that happens. And I have had patients come into me and say, how can we bill $235? And I'm like, but did you notice I only got $15 for that whole thing? And that's the non-handshake that we have to actually do with these idiot insurances. And so that's going to be something that's going to change. It needs to have much more of a direct kind of relationship with that. And so you're going to see some of that change as we go along here, okay? Which relates us over to the healthcare points. How is healthcare going to change? Now, I'm not going to get into the silliness and the crazy stuff that we have with MedBits. I'm not going to get into that conversation. You guys want to talk about that? Go ahead and talk about that on your own. Those are Star Trek levels, Star Wars level stuff. I'm not going to get into that conversation. But healthcare is going to change. They're not going to go away. We need healthcare, but we need to have reasonableness with that. Most healthcare has been throw pills at you. We need to see that come down in a much more reasonable, more straightforward mechanism. We need physicians, we need healthcare professionals really looking at how do we heal the people? How do we get into that mode of making a difference? How do we fix that leg issue? I'm thinking about my father-in-law, who's got this problem with his leg, and he's 88, and they were first attacking the heart issue. Well, and they did this massive, invasive situation to check on the heart for his leg. And then they want to do an MRI for his leg. And it's like, no, this is, they keep jumping over because these physicians and these hospitals wanted to make the money off of the insurance because they could. And so some of this stuff, we need to have a whole bunch of people sitting in line with a whole bunch of spankings, okay? And, in the past, there were times where, grandma used to spank all the kids because they must have needed it sometime, And the reality is that's what's going to happen. There's going to see a whole line of this. But once we get past the spankings of all of them, we're going to start seeing and realize this, that the healthcare, we're going to start seeing some of the good people coming back in, and they're going to change some of this stuff. And you're going to start seeing your trust in them grow. But because there's going to be more of, hey, what can we do? What kinds of real medicine can we do? What kinds of changes can we make to that? And we're going to start seeing, hey, we healed that person. And that's a great thing with that. So we're going to start seeing some of that stuff making a real difference with that. And yet, we don't actually know all of that. People who say, the med beds are going to take them all away, it's just stupid. That's just dumbest thing in the history of the world. Don't talk about that. Insurances are absolutely going to be needed, but they're not going to cost anywhere near what they've been costing. There has been a lot of elitist stuff in there, and we need to see some of that stuff go down quite a bit. So if you like what we did, please subscribe, like with this stuff. I know there's going to be some controversy in what I say. I don't ever talk about this in ways that will make y'all happy inside, but I'm trying to give you some reasonable, logical kind of stuff here. I promise you, I don't know everything on there. I wish I did. I'm just trying to give you some logic in that. Thanks so much for listening.